Patient got recently extracted 3, 4, 5. You can see in the reformatted view. You can see the very poor bone quality and the labial aspect of canine and premolar. So we are going to place 3 implants. We'll see the post-op now. Immediate post-op. We place 2 compressive and 1 basal, 2 rough surface and 1 smooth surface. The distal most is the basal one, 3.614, getting engagement from sinus floor. The middle implant is 4 into 12 mostly, we will see. Yeah, 12 mm. We could have selected a 14 mm also, but this is more than enough. We got good stability. The mesial most implant is 3.715 into 18. Yes, it is 18.